All right. Got some people in. Ooh, Acrimony 2 is coming. Okay. Awesome.
You like that, eh?
I liked it. Yeah. I don't watch much TV or movies, but I did sit and watch that crazy movie with Taraji P. Henson. All right. Okay. Oh, Lord, this could be a good show. Boy, when y'all see Doc in the house, y'all is. Oh, my body. Oh, man. Doc, your presence precedes you.
I see.
Your presence precedes you. Reynard Hotel. Okay, it's from the 1960s. All right. When did that die a natural death? When was that hotel closed?
What
Doc?
hotel? What hotel?
Reynard.
Not a hotel.
That's the one that drug collapsed the other day. The old building on Blue Hill. The one that just collapsed this week. They said it was a big hotel back in the day.
Oh,
And I'm not from Nassau, so I don't know it. That
I
that
don't. I don't remember that.
okay.
So
I mean
much
it was
people on.
okay, here we go. It's on. Hey, you will find the time is 4 o'clock when the nation starts to free the mind. Free the mind. There are many shows on the airway, but not like free your mind. Since the ever died, you won't find none like free your mind. From the ghetto to the office, hustlers to the sky. From the fuse to parliament, all the freedom of the time. I got to freedom of mind. Release you will find. I got to freedom of mind. Release you will find. It's about that time. You got freedom. It's about that time. You got freedom. It's about that time. It's about that time. All right, Doc, let's roll. Star 106 hits a pleasant Friday. Good afternoon to each and all. Welcome, welcome, welcome to the weekend, first and foremost. And then, of course, welcome to another Feel Good Friday edition of Free Your Mind, brought to you courtesy of none other than City of Hope, formerly Cancer Treatment Centers of America. Thank you to Collect, the Bear of the Bahamas, Pinder Tile. Got to say a big thank you to Muffler World, KFC,
Big thank you to the Fresh Market and, of course, ESC Distributors and the Keep the Vibe Alive Music Group. And, of course, a big thank you to Alpha Sound Promotions. Getting ready for Best of the Best Reloaded on November the 2nd. It all goes down at the Super Club Breezes grounds, and tickets are already on sale. All right. So, for the best in Rake and Scrape, for a definite good time celebrating us, you definitely want to be in the place. All right. So get your tickets now, Bahamas etickets.com. All right. Good afternoon to each and all. 106.5 on the FM band is where you find us. Channel 976 on cable. And of course, to all the Facebook faithfuls in for the show, because the doc is in the house. All right, Star 106 and Natural Empress on Facebook. All right. So with that said, the days are winding down. It's like 90 little bit, I guess, like 92 days or so until Christmas. But more importantly, we are now the 20th day of September, which means we have exactly 10 days left in the month and still ample time to bring some awareness to Prostate Cancer Awareness Month. So, with that said, good afternoon to you, Dr. Fox. How are you? How are you? How are you?
I
Hi,
am good. Good afternoon to you, Empress, and good afternoon, Bahamas. And it's good to be back on the show.
Yes, good to have you. We always look forward to you, imparting all this knowledge. And today, bringing some awareness to prostate Cancer Awareness Month. Now, I mean, like I said, we didn't let the month pass without making some mention, because we all know when October rolls around, that automatically takes precedence. That's the month that everybody, for the most part, is aware of without even thinking about it, leaving all others kind of in the dark. So we're going to do our best today, before the month ends, to shine some light on this particular month being Prostate Cancer Awareness Month.
Indeed, September is designated Prostate Cancer Awareness Month. And so we at the Cancer Society try to bring awareness because, as you know, prostate cancer is the most common cancer in Bahamian men. Current statistics show that 1 in 6 men will develop prostate cancer in their lifetime. That's pretty significant, eh? And it's one
Yeah.
of the most avoidable, curable cancers that we have. What is the prostate? A lot of us don't even know what the prostate is. I'll give you a joke before I start. I had this Caucasian lady came in. I had seen her husband and diagnosed him with prostate cancer. Very dicty lady. And she came in and she said, "Oh, Dr. Fox, I just came to thank you for sorting my husband out. I sent him to the US and he got sorted out. It was early stage, so he was completely cured." And she said, "I was so impressed with you sorting my husband out. I came to get my prostate checked."
As
I
well.
said, unfortunately, females don't have a prostate. So the prostate gland is a gland specifically in men. It is a walnut-sized organ right beneath the bladder. So what is the purpose of the prostate? The prostate makes semen. Semen, when you ejaculate or come, is the clear part of the ejaculate that provides nutrients and whatever else is needed for the sperm to swim to the egg. So that's the purpose of the prostate. Um, Very little sneaky little gland that is just we don't even remember we have until we reach like 40 and it starts to enlarge. That's called BPH, benign prostatic hyperplasia. And it gets a little enlarged, so it causes you to pee a little bit more, the frequency, the dribbling, the embarrassment of having prostate disease. And sometimes the swelling, the cells continue to change and mutate and go on to turn into cancer cells. So this is why we advocate for people to have early prostate screening, especially if there's a family history. Like my dad died from prostate cancer, so I need to stay on top of my game and have your prostate examined. The problem with examining the prostate is a lot of men fear the exam. The
So
finger.
yep. We're gonna get into the exam itself. We're gonna take a quick break though. But quick question for you based on what you've said thus far. As a man ages, is it normal for it to become the prostate itself to become enlarged? Is that normal?
Yeah, that's a normal phenomenon. Some more so than others, some later than others. But that seems to be a pretty normal phenomenon, especially in this country.
So is it that the overall health of the prostate is deteriorating why it is as you age, why it becomes enlarged?
Well, there's a myriad of factors that contribute to that. Um, and again, genetics, environment, exposure to sexually transmitted diseases and infections, uh, no sex, too much
No
sex,
or low?
no, no sex, and too much sex. Um, a whole myriad of factors contribute to enlargement of the prostate. So to say one specific thing contributes is very difficult.
Okay.
Um, the thing is, we know that once we reach a certain age, the prostate is going to start to enlarge, and this is when we recommend people to have their prostate screening done. Again, like I said, the biggest fear is the exam itself, the finger in the butt.
All
But
right, we gotta talk. Hold on, let's not run them. All right, we're gonna take a quick break right here. Gonna find out what's happening on the streets. We got our Eye in the Sky traffic report, followed by more of a Feel Good Friday right here with Dr. Fox.
And the hood look for traffic this afternoon.
Man, don't scare him. So I know this will catch somebody's attention. Say, gee, you got to balance how much sex you have now. So when you say no sex or little to no sex versus too much sex, both can cause a problem?
well, the thing is, they did a study in
Fine.
Catholic priests, and they
How
found
you know I was thinking about the Catholic priest?
leave my
How you know I
Catholic
was-
priest alone.
I'm just saying that's the first person came to my mind. I said, Lord, look at Monsignor so and so, and Canon so and no Canon would be what, Anglican, yeah, but
Yes.
yeah, Monsignor and Bishop and Father, yes, Father. My God, so it's safe to say that men with little to no sex can develop prostate. Is that what it is?
Well, they did a study, and they said that they observed a moderate excess
Mm-hmm.
of prostate cancer deaths in priests over the corresponding mortality rates in regular white males. So there's a slight increase due to no sex. Um,
So you know, as a doctor, tell him go have some sex then.
Emptying the prostate, yeah, keep your prostate empty, and it'll be healthy.
So they would have to find a way to empty it other than finding a woman. Let's not get into that. You know what? Never mind. I even going there. That's out of your pay grade.
Which Bay means can say Dr. Fox say, and that
Hey,
can
how
be
you know?
Dr.
How you know? Empress said it. I said it.
And,
I said
and yeah, I just gotta say, Empress back him up, so that's gospel. And can't tell them nothing, you know?
I said it. You didn't say, but I'm trying to say if the easiest way is for them to empty it, you don't want Father so and so to die. So empty it by any means necessary. Kill myself.
Well, they
laughing.
masturbate. I mean, ain't nothing wrong with that.
No, you and me. Well, you ain't know, but I know that they live very close in proximity to the nuns who say they don't have none.
Right.
Anyway, that's another story for another time. I can leave
Yeah.
that alone.
Before people start
Yes, we
debating
going.
about talking about the Catholics.
I was baptized Catholic, honey.
Well, I'm Catholic, you know, and I
Yes,
make my pilgrimage to Vatican City.
okay,
So
so let's not talk about the people. Let's not do that. But we know they have sex. It's a natural thing. I never understood that, but that's a topic for another day. And that's why the Anglican was like, man, forget that. I need some.
Yeah.
Star 106 hits. Welcome back. Free your mind on a Feel Good Friday, Prostate Cancer Awareness Month, still in full effect, and we're doing our endeavor best to bring some awareness. So, fellas, this is not the time in this day and age where it is curable. Once early detection, once it's detected early, you have a chance at a 100% turnaround. So why would you not? Why would you let one simple test deter you from possibly living a real fruitful life? So we're going to talk about the prostate.
One word, homophobia, which is rampant in this town. But anyways, that's a topic for another day.
No,
A lot of
it's a today topic
a
because we
lot of
need
men,
people
a
to
lot of men
understand that this, unlike other cancers that are not so curable or that are harder to cure, here's a chance for you upon early detection. You can, lengthen your lifespan.
indeed and live a better quality of life. Yeah, but a lot of men don't do it because they listen to the boys around the table with their beer in their hand and they're talking about this digital exam and they're too macho for that. Well, I have good news for you guys. You don't have to do that no more. We do the ultrasound. That exam is only good to detect if there's a lump, which means that the cancer already spread outside the body or the prostate and you can actually feel it. And then so we do the ultrasound. If we see anything on the ultrasound, then we refer them to the urologist for biopsy or do a CT to further enhance whatever lesion we see and make sure that it is possibly a cancer. And then we send them to the urologist for biopsy and then they take it from there. Now, what are the risk factors? So you don't have to worry about the digital no more. At least here we don't do that only if absolutely necessary. If we see something, I want to feel it to make sure it's what I'm seeing on the ultrasound. We do the ultrasound, and we're pretty happy with that. We've had pretty good success rate with detecting early masses with that. So we will continue to do that. What are the risk factors? Well, being black is one,
My God.
African ancestry. Um, and every time I talk about cancer, I talk about obesity.
Okay,
So
hold on. Wait. Earlier this week or late last week, it was so kind of refreshing to see persons sharing the chart of the countries all over the world that suffer. So, in big numbers where obesity is concerned. And there was
it's
the
number four.
Bahamas at
Number
number
four.
4.
And we see absolutely nothing. The government sees absolutely nothing wrong with that. Let me tell you what the problem with obesity is. It's very, very expensive.
Oh,
Okay? Because it creates 1,000,001 health problems. We have socialized medicine, so who have to pay?
the people.
Okay. So these people think being fat or what they call solid is the end thing, and it's not. You have so much high blood pressure, heart disease. How many Bahamians at the age of 50 like finish because of heart problems? They can't walk, they can't get around, or arthritis killing them because they're overweight. They have no quality of life, and they're just a burden to the society and the system. Um,
Right.
but we put no emphasis. We think being fat is cute. We want the baby to be fat. We want this one to have chubby face and the next. And we don't we don't put no emphasis on healthy eating and healthy living and this and that. I mean, we do to a certain degree, but we don't enforce it. We don't make
No,
it.
but how in statistics like this showing this little dot on the map as number 4 in the world, how is that not an alarming or a point of where we need to sound off the alarm and kick the doors off and make something happen?
No, no, we like to be number one. We're trying to get number one, like how we was with HIV, and then and diabetes and high blood pressure. We was number one in all of them, and we feel good.
No, Doc, I'm serious now. I serious.
That's nothing to be proud of. I just gonna read you something real quick. Bahamian men who are obese or overweight put themselves at a greater risk for developing a more aggressive form of prostate cancer. They did a study with over 1 million men for an average of 21 years, and they found that fat men whose body BMI is greater than 30 kilograms per milligram is the risk is increased by 9%. However, obese males at the age of 50 to 59 at the study completion had a 58, you listening to that? 58% risk, increased risk of prostate cancer. Okay?
Mhm.
This Bahamian men now,
Oh,
Bahamian men. So these guys with these big bare belly and these wide hip and these, I don't know what, weighing 300-400 pounds, just a time
a walking time bomb.
yeah, waiting to explode, and they don't see that, and then they're around here with the homophobia, don't want to get the prostate check, and like I said, just being a burden to the society and to the healthcare system. So when they do get diagnosed now, it's so late until there's not much you could do other than
Wait
passive
for
therapy to to comfort them and keep them comfortable until they die
So,
and taking
question:
up
what is it
the
as
image.
women? What is our role in all of this? Because if you have a man that's increasingly by the months getting bigger and bigger, what role? What is our role in helping to help this man to help himself?
Well, first of all, you have to look at that situation. That's a very telling situation. Um, I don't know. People are married, but yet they really don't care about each other because I can't see you. And that's where marriages fail, eh? She didn't marry him looking like that. So now she disgusted every time she look at him and she don't have nothing to do with him. And he's not doing anything to help himself. And so the marriage now goes down the tube. But when you big and fat like that, you can't even take care of yourself. You can't bathe properly. You can't clean properly. So now self-esteem comes in and self-confidence. So you don't feel good about yourself. So you're not going to go to the doctor to check to prevent anything. Because one, you got to take off your clothes. That's a no-no because you're too fat. Um, so it's a whole negative feedback cycle that's associated with being obese. Um, But I can't understand why people allow themselves, once
Before,
you see your
yeah.
clothes are getting too tight, then you should cut back, exercise. And then you have some of these women, I don't know what to say. And I say this because I'm going to give you an example. I had a family member who, a male, 65, tired, could barely get out of bed, white like a ghost. This been going on for 3 months. And then one day I saw him and I was like, oh my God, what happened to you? He was like, I don't know. I've been so tired and this, that, and the next for the last couple of months. Did a blood test. His hemoglobin was 5 point something. I asked him about his prostate and urine. He said, yeah, he'd been seeing blood in the urine. He going every minute, blah, blah, blah. Did an ultrasound. He had 2 lesions on the prostate
Right.
and they were white like snow, which means they were cancerous. Sent him to do a biopsy. He did the biopsy, and of course, they were cancerous.
Sure.
So, when I had him and the wife in the room
Hold on.
discussing,
Before you go further, the blood in the urine wasn't an alarm. Like people just say, "Oh, I just got blood in my urine," and they continue with life.
yep. So I had him and the wife in the room, and I'm discussing, and I'm looking at her. I'm like, so help me to understand this. What kind of wife are you to see your husband, the only breadwinner in the house, struggling every morning to get out of bed, taking half an hour to get up off the bed and white like a ghost, and you see blood in the toilet and you do and say nothing.
But doc, time out. Let's start back with the man in the mirror, because
No,
at the end
no,
of
no, I
the
can
day,
get to that. I can get to that. I
Okay.
can get to that.
Okay.
I can get to that. So some of these people don't have the support system they need. Okay, he working hard. He's the breadwinner, right? Accommodating her. She ain't doing nothing. She out there spending money. She doing this, that, and the next, right? So he's thinking, okay, I have this little blood. Maybe I'm working too hard.
I
Should I
get
go
something
get
too
this
heavy.
check out?
Yeah.
But if I take time off to go, then I can miss this job and I ain't gonna make this money. She can get mad.
I got you. The pressure. Okay.
The pressure.
Yeah.
So they neglect themselves to accommodate other people. And by the time it's due, unfortunately for him, he was just a stage two. But he had a couple other problems going on that, that
Contribute.
contributed to his tiredness and everything. But, we got it sorted out. But this is what you're seeing. You're seeing these men, they're just letting symptoms accumulate and accumulate, and to the point where they can't function because they're so exhausted and tired from the microscopic blood loss or the spread of the cancer somewhere else. And it's just eating up all their energy. And by the time they come in, a lot of the time it's too late. But um I don't know. We need to take the phobia and the stigma out of having cancer screening, prostate, breast, etc.
HIV.
Yeah,
Don't forget the HIV. Because every time there's a free screening for HIV where you just come in, know your status, know your partner's status. It sounds easy and it's so hard to get people to do those tests because I really feel like people don't really want to know.
I agree. And like I say again, Bahamian men are at greater risk for developing prostate cancer due to their racial profile, genetics, overall high obesity rate, and another thing, high alcohol intake.
Stick a pin in that one. We're going to take a quick break on that one. Let that one settle on some ice. All right. This is Free Your Mind on a Feel Good Friday. Dr. Fox is a Fox Friday right here on the Star. Stay tuned. Listen to me. Well, you done X everybody out because either they fat or they drinkers. So what we left with?
I know. You know, I have this friend of mine. He's 40, how old he is, 41, and he have two kids, and he wanted his daughter every other week he gotta go to the school. She 13, the boy's having sex with her, and she always in trouble. So he was like, boy, what you do to get your children to be sensible? I say, spend time. And I said, you go to see your daughter at midnight to carry money to the baby mother. Oh, I can't stand the baby mother. Go to your daughter at midnight to carry lunch money with a beer in your hand and a whore in your front seat. What kind of example are you setting for this child?
Hold on. Let's go live. Star 106 hits. Welcome back. Free your mind on a Feel Good Fox Friday. All right. It is still a prostate cancer awareness month, and Dr. Fox is here to enlighten us on early detection and the importance of screening and the fact that the so dreadful test that everybody is aware of, not that it's no more, but there are alternative routes on how you can have your prostate checked, fellas. And fellas only. Doc?
So another thing I need to mention is when we talk about breast cancer, as you know, next month is Breast Cancer Awareness Month. So all the emphasis on everything cancer will be on for October, but there's an association between the BRCA gene that causes breast cancer and the more aggressive forms of prostate cancer. So if somebody in your family has been tested positive for BRCA gene, then you need to get your prostate tested and sorted out to make sure you don't go on to develop prostate cancer.
Okay.
But again, let's talk about drinking. They did some studies and they found that men who consume more than 4 or 5 drinks a week are at an exponentially increased risk of developing prostate, not just
5 a
prostate
week?
cancer. Huh? Yeah. Not
Really?
just prostate
That's a
cancer,
long
but a lot of cancer. So you see these young guys, everybody, you going to come into work in the morning. The young guys, they walk in with either a bottle of Collect Gold or Guinness in their hand first thing in the morning. Even they brush the teeth yet. First thing in the morning, you see them out wherever they go. Everybody got a beer in their hand or a cup in their hand, and this the end thing for young people now to be half drunk, not knowing the damn. So I don't even know what else to say. But again, early diagnosis of prostate cancer has a 95% year survival rate, even in African men ancestry. So that emphasizes the importance of screening, family history, genetics, so that we can keep these numbers down. Because dying from prostate cancer is a very nasty death. It usually spreads to the bone, it's extremely painful, and you suffer for a long time. So to avoid that, see a GP, get your prostate sorted out, and live a long, healthy life.
All right, I think you need to reiterate for those that are just joining us the new way of screening.
Okay, again, like I said earlier, we suggest that men over the age of 40 should have an annual prostate exam and a PSA. PSA is a prostate specific antigen. It's a chemical that's released from the prostate when something is wrong, and we can detect the level. Depending on the level, then we can tell if it's cancer or not. Not all high levels of PSA means that there is a cancer. There just may be some significant inflammation. And again, like I said, early detection has an excellent cure rate. Now, a lot of men don't do the prostate exam because they fear the doctor putting his finger in their butt. Most people don't do that anymore. Most doctors who have an ultrasound in their office will do an ultrasound, even a 3D ultrasound. You can see the prostate, you can see the lesions. If you're not 100% sure that the lesion is there, you can send them for a CT with contrast, enhance the lesion. And if the lesion is there, then you send them to the urologist for an ultrasound guided biopsy to get some cells to see if there is indeed prostate cancer. Early prostate cancer is 100% curable, and you
Wow.
go on to live a normal, healthy life. Sometimes you have sex problems depending on the method in which they use afterwards, and sometimes you don't. But I mean, to swap a life for celibacy, I don't think that's a bad exchange.
Yeah. Yeah.
But prostate cancer, the numbers, like I said, are very high in this country. 1 in 6 cancers diagnosed in men will be prostate cancer, and the death rate is pretty significant. I've seen people come in. One patient came to mind. I checked his prostate 1 year, and he was fine. I hadn't seen him for 4 years, and he came back, and I didn't recognize him.
How?
He had lost so much weight. He was really dark. He just looked a mess. And I asked him what was happening. He told me he had prostate problems like frequency, and he noticed now blood in his urine all the time. Did an ultrasound. You couldn't see prostate for cancer. Sent him to the urologist. He had metastases to the spine and the pelvis, and he died 3 weeks later.
What?
Yep. There was nothing they could do for him. And that was in the space of between 4 and 5 years.
Wow.
So he had some and he was slim. He had some aggressive form of prostate cancer. But after he checked it the first time and it was okay, he never came back to do a follow-up.
So
So-
how often? Yeah. Well, how often is it supposed to happen?
Well, normally I tell patients to do your annual physical around your birthday so you could remember. And every time you do your annual physical, if you're over the age of 40, have your prostate checked.
Mm. Mm. Well, I
So the
think.
key to
Mm,
cure is early detection.
right.
And
But again,
people don't understand the emotional, the physical, and the financial toll of advanced prostate cancer is profound. Patients and their families and their co-workers and everybody suffer together because these people literally sit down watching you go from 10 to 0
real
and
quick.
no time.
Mhm.
So um, if you could prevent something, then prevent it. Get
Yeah,
your
but
screening, throw the
that
fear away, reduce the risk factors like the smoking, the drinking, um,
no exercise.
no exercise, sedentary lifestyle, and try to get yourself in order, you know?
But like you said, even something like obesity, which we are ranking number 4 in the world, is not, raising the alarm. It's not, people are living their lives as normal, being fat. And, like you said, we can't
And
change
see, and
the
see
mind.
that's my problem with 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 things in this country. We didn't go there overnight. We climbed that slowly. So while we were climbing from the bottom and the powers that be noticed that we were climbing, why didn't they do something? Why? They want us to get to number one, I guess, and then they'll, try to do something. But then it's too late. That means you can have 90% of the population overweight. That's a health crisis.
And we know
And
the system can't, it's an overload as it is.
it is. And it's just going to cost the taxpayer more money.
Hmm. Okay. So again, if these numbers just recently came out and people were sharing it, and I guess that's a step in the right direction in terms of bringing awareness. But in terms of, even look at, you start at the very bottom, the children, the school lunches. I understand that there's now certain schools getting the school program, they're getting free lunch or whatever, but what is it that they're actually feeding? What kind of snacks do
See,
your kids buy?
you have
What
to look at
are you giving them?
lessons have shown us in this country when something is done like that on a mass scale, right? Is it being done to benefit the receivers or is it being done to benefit the givers? Are the givers benefiting by making this extra money and selling or providing inferior quality food to these children just to make the money without any checks and
Nutritional
balances?
value.
Yeah, without any checks and balances, you just hire somebody to fix this food and stuff it down the children's face. We don't know the quality of the food. We don't know this. We don't know that. No, no, no. So somebody is benefiting financially, and then it looks good. It looks good in the public eye that we're doing this and we're doing that when we're actually doing nothing. Um, so
Well, we do know that good. You know what I mean? Can you imagine them giving apples, strawberries, and grapes? Even just that fruit?
okay, you know how
Too
expensive that is. You know how expensive that is.
That's what I'm saying. You know how much
Okay,
a sack of 50-pound grits costs?
okay. So you have to look at it for what it is, and then who's benefiting. Um, Food alone is not going to help these children. They need to know that they need to exercise, they need to drink water instead of sugary drinks.
All
Um,
day.
yeah, and keep active. Are they doing that as well, or they just providing this for an Instagram moment?
Wow.
Um, yeah, but us being on that list, we're not going to stop until we're number one, like we do with everything, and then we'll try to do something about it.
Well, that's a sad reality. Not one that I was hoping for. Striving to be number one would be in sports, in music,
Yeah.
in education,
And BGCSE results.
anything else but number one in being fat.
Yeah.
Let's
Coming
read
to
this
number
one. Thank you, Mr. Smith. Farm some of your own stuff to cut down expenses. Imagine not having to buy tomatoes, mangoes, oranges, and other stuff because you just gotta go in your backyard. Ooh. Yes, self-sufficient.
But that takes too much effort and energy. Why do that when you could send to the store and they bring it for you?
I
And
need Kevon. Stop.
that's our own instinct now.
Kevon says we go for gold. That's why it's in the flag.
I agree. We have to be number one.
Oh man.
But
All
I can't reiterate enough and stress enough the importance of
early
early
detection.
cancer screening, and all cancers, not just prostate, for early detection, so it can be completely eradicated and you have a good quality of life.
Yes. Now, in terms of testing, where do people go? You know, some people just totally oblivious as to what the first step is.
Well, medicine should be like this. It's not like this here, but it should be like this. The primary care physicians, you go to them, let them make the initial diagnosis and refer you to the urologist.
Right.
But some of us, we think we so important, we have to sidestep the primary care. And a lot of times you don't need to see a urologist. The primary care could deal with it. And we go straight to the urologist so we could have something to talk about at coffee or tea the next day. But you don't have to go specifically to the urologist. You go to your primary care, get your annual, get your ultrasound or your digital, whichever one you prefer. Get your PSA, and then determine from there what's going to happen.
Okay. All right. So there you have it. There's still 10 days left in the month, and beyond September, you still can go and have your screening done. Ladies, play your role in it as well and ensure that your mind. But what age should this start, Doc?
Usually 40, I say 38 with family history. Women, watch your men if they go into the bathroom every second to pee. Okay? Look in the bowl to see if any blood or pink in the bowl, because they can do it. Watch your man to see if he's not getting a firm erection. He may get hard initially, but it doesn't stay hard. And then his lack of interest and desire for sex. These may be signs of an enlarged prostate, an irritated prostate, an infected prostate. So keep your eyes open, notice things, because a lot of men just let things pass.
Let me read this one real quick. I think that's our problem here. We don't want to do things that require effort. We don't want to run, walk, exercise because it takes too much effort. We drive around the parking lot for hours just to look for a close parking spot to the door. We don't want to do the extra walk. We drive across the road to the store instead of catching a quick walk. And that is facts.
It is. It is.
Ain't taking no stairs. Wait for the elevator. Keep pushing it and getting irate.
Yeah.
Taking
Yeah.
too long.
For one floor. For one floor.
One floor. Oh, Doc. Thank you so much as always.
We have a long way to go. And I will continue to
Advocate.
push, and advocate for what needs to be advocated for health so we can be a healthy nation, and move forward and be the best little country in the world.
Thank you so much, Dr. Fox. And folks, y'all know what to do. Keep us locked. Top of the hour, 5 o'clock. Your Drive at 5. Your Friday edition comes your way right here on your hit station. We're Star 106 Hits. So, guys, for all of you that don't have a general practitioner, you want to get your man screened, or fellas, if you want to get screened, Dr. Fox is located on Collins Avenue next to the Frank Hanna building. What number Collins Avenue is that, sir?
117, 117.
117. All right. 325-1649 is the number to call if you'd like to make an appointment. But take it serious. Absolutely. Take it serious because no one is exempt. And that's it. And that's all. This one says, well, if the lady doesn't pick up all those stuff in her man and she doesn't leave and find out new one. Keep on. I'm tired of you. Oh, Lord, when you was talking about the women with the fat man, keep on saying, well, the woman fat too. Let me see if I can find that. Oh, Lord, say the woman fat too and getting their body done. Oh, my God. My God.
Yesterday,
Huh?
I had one in yesterday. Tummy tuck, Brazilian butt lift, perky breath. I look at this woman. I was like, you need to go get a refund.
You said
She's still
that?
300 and something pounds.
So what did they do?
I don't know. All I know is I see a bunch of scars. That's it.
So she had the perky breasts and the Brazilian butt and thing, but she's still big?
Yep. And look bad.
And you told her that?
No. What are you telling that for?
Oh, you say you go get a refund. That's what that means. You look
No,
bad.
that's what I'm thinking. I didn't say that. I was thinking that.
Oh, glory be to
You want me
God.
to point with green delay?
Oh, because I know you are telling the truth. So I'm not.
No, I didn't say anything. I didn't say anything. She'll come to realize she made a mistake.
Yeah, but please also for the persons that are considering all of these tucks and lifts and things that you two got to be healthy to do that. Can you please tell them?
Exactly. You need to be healthy. We suggest you lose as much weight as you can first, because remember now, when they cut and dig into that fat, that's just a petri dish for infection. So try to lose as much weight as you can. Do exactly as the doctor tells you before. Make sure your blood levels are okay. Make sure you do all your blood tests before you go, because you may just die on the table.
Jesus. Doc, enjoy your weekend. All
You
right.
too.
Thank you.
Thank you. Thank you. Thank you. And
Yes,
take care.
Yes, chat to you later.
All right.